As the number of coronavirus cases surges in some states across the U.S. tonight, we take a look at where things stand in our continued fight against the pandemic. Joining me now on Skype to talk more about this is Dr. Mark Strand, professor at the North Dakota State University School of Pharmacy and Department of Public Health. Dr. Strand, welcome back to the show. So great to see you.
Thank you.
Well, yesterday we heard from Dr. Anthony Fauci. He was testifying on Capitol Hill, and he said the rate of new coronavirus infections could more than double to 100,000 a day if current outbreaks were not contained. In your opinion, what do you think needs to be done to stem the tide?
Well, it is unfortunate. On April 24th, we peaked out at 40,000 new cases a day, and we saw gradual suppression through May and June. And now we're seeing a return to as much as 47,000 cases a day on the 26th. So this is most unfortunate. It shows that we haven't been able to maintain suppression in certain regions of the country.
I know we've seen some success, that is, with social distancing and, of course, the use of masks. Do you think just those two things can help us balance this need to reopen and also the need to contain the spread of COVID-19?
Well, those are certainly precautionary measures that are helpful. There's no absolute way in which to suppress transmission, but those are the methods that we have at our disposal now without a vaccine. So we need to continue to have high levels of testing. We still have states that have only 6, 7, 8%, Texas, Florida, Arizona, of their persons having been tested. So they don't really even know the true rate of disease in those states. So it's no wonder that as they relax their shelter-in-place orders, they're starting to see those cases rise in numbers again.
Yeah, and it seems that, at least we've been hearing, that it's younger people that are now making up the growing number of new cases. Why do you think that is? And are they experiencing the same type of symptoms and complications as older patients?
Well, the older patients have just taken the precautions more seriously, so the total number of cases has been higher among, younger individuals, younger to middle-aged persons. So by virtue of having a larger number of persons having been infected, then you're also seeing an increase in hospitalizations among those younger patients. There is an observation that younger individuals with a stronger immune system will give a more aggressive immune response, which can then flood the immune cells into the lungs, which then causes that respiratory distress. So yes, many young persons think they're perhaps invincible and put themselves into social settings where the risk of transmission is higher and are not aware of the fact that they could still end up with severe disease or even hospitalization.
Yeah, we only have about 30 seconds left, but I want to ask you this last question. Earlier in the show, we reported on encouraging results on the vaccine front. What more can you tell us about that?
Yeah, there's a good candidate coming out of England that's already in stage 2 and 3 clinical trials. The hope is that there would be delivery of first doses by October of this year. And so we're hoping that those vaccines prove to be available and can be produced at high levels starting this fall.
Well, Dr. Strand, thank you so much for coming on and sharing your insights with us. Always appreciated. Dr. Mark Strand, professor in the North Dakota State University School of Pharmacy and Department of Public Health. Thank you again.
You're welcome.